Hello, my name is Cindy Krafft, and I want to thank you for taking time out of your busy day to talk about OASIS. For those of you who remember, as I do, when the whole OASIS thing started many years ago, it seemed like we had that original tool hanging around for a considerable period of time before any real substantive changes were made to the data collection instrument. Now we've gone from OASIS C to the OASIS C have to deal with ICD-10, and now lo and behold, we're moving toward OASIS C2. It's interesting how, after that long period of relative stability in the items, we now see changes happening much quicker and actually many times for reasons beyond things that are just specifically issues for home health. I say that because when we look at the implementation date here that's been set of January 1st, 2017, a lot of the impetus here is not necessarily at the demand of the home health industry or issues specific to us, but are really being driven by the Impact Act. This push toward a more standardized way of collecting information across the post-acute continuum. For those of you who are still not sure the Impact Act has much to do with home health, we should see this as another sign that change is going to keep coming, and we need to make sure that we're ready. So in our podcast, what we want to do is just kind of hit some of the highlights to give you a preliminary feel for what's different, and then in subsequent education, really kind of dig deeper into some of these things. But you really just want to kind of get that initial lay of the land first before we start pushing any sort of panic buttons, as we're prone to do when something changes. What will be different? Well, part of it is simply a formatting issue, that we're going to see a rearrangement of sorts of just how the questions look cosmetically. We'll also see some new standardized items, actually 3 of them. Then we're going to see some that got, modified a little bit and renumbered. And they're specifically listed there on your slide, as well as the look back time for a subset of questions. That whole what time period am I supposed to be taking into consideration has been modified slightly. We did provide here the link for you to get the entire copy of OASIS C2 so you can take a look at it, become familiar with it. But I think the interesting place to start is with this formatting difference, because I know when I pulled up my copy, I'm like, what? Oh my gosh, what did they do? But then you kind of look at it and say, wait a second, this is really the same content with a new look. And really driven by in other data collection tools. It really isn't those, check boxes next to one, a different one next to 2, a different one next to 3, which is what we're used to seeing on a paper OASIS tool. It really does look more like this, that you have the options presented to you and you enter the number in the box as your response. For those of you on electronic medical records, you may say, well, I don't think that's really going to be that much of a difference for us. More than likely not. But for those of you who are using paper, either completely or maybe for some of your PRN staff or certain individuals, just rest assured that the shock value of, oh my gosh, this is a whole lot of different, what you can see here is it's really just a rearranging. It doesn't change any of the items you see on the screen. They're the exact same number, the exact same wording, and the exact same response options they already were. However, some of this reorganization does change things a bit, specifically as an example here for 2102. That one on paper has been a table format where you went down the one side of the screen and then you came across and looked at what your options were in the different columns. By moving to this pick a score, basically, we now see the listing of all possible response options for each individual part of this item. I'm still a little on the fence here, but I think this could be better in relation to helping clinicians really think about the individual response to each one of these areas. Because what I'm seeing on chart auditing is almost a, if 1 0, they're all going to be 0, going to be 0, going to be 0, or 0, or they're all almost a, just pick a column and say they're all that. We want to make sure clinicians are really evaluating each one of these areas and choosing an appropriate response. That may be the same number for all of them, but ultimately it should reflect patient individuality. And before you get excited and say, oh, they cut it all down just to these 2, no. All of what we're familiar with now as rows are intact. But if I put all that on the screen, you wouldn't be able to see it. So I just picked the 2 as an example so you can see how that reorganization looks for that item. specifically. When we touch on the first of the three new items, it's interesting because it's addressing diagnosis, but it's not a coding question, which is something different. We haven't really done that before in OASIS, and it's specifically to peripheral vascular disease and diabetes. So the issue here is, does the patient have one or both of these? And we are to mark all that apply. You can see in the item they're giving deference to the actual coding to ICD-10, but it'll be interesting to see as we move into the next few months and better understand some of this, kind of what the thought process is with this, and how that is going to be tracked and trended in relation to maybe outcomes or process measures or those kinds of things. Be interesting to see what happens with that information. The next one is kind of something we would routinely do, and I've seen routinely documented in charts for a very long time. It's now an actual OASIS item where we're going to be recording their height and weight. And it does give specific instruction with respect to rounding, so it's not getting to the umpteen thousandth possible number we could use. But I think what's also an interesting piece is the issue on the weight. It does reference what is basically the agency's standard of practice. I'm not so sure we really intentionally had a standard of practice around this. It may have kind of naturally unfolded in the heart failure population about taking your weights daily and in the morning and its specific criteria. But we're going to need to prep ourselves over the next year for the clinicians to know what is that expectation about the taking of the weight. And I know some of that's going to be difficult. You can't say it's a certain time of the day because you have admissions and OASIS events that are in the morning, the middle of the day, sometimes in the middle of the night. So to say we only do it, at 8 a.m. would be way too restrictive. But we want to look at some of those things about shoes on or off, voiding or make them void first. I mean, those are kinds of things that we're going to have to look at and make sure we're being consistent across the organization about what those expectations are for staff. Then we have a new item with not even an M in it, this GG0170C. This looks very different to many of you, but where it's really coming from was what started out as the CARE tool, being the entire instrument as anticipated of being something that would replace post-acute assessment tools, to morphing to specific items that will be pulled from that and inserted into the tools for home health, for inpatient rehab, and for skilled nursing facilities. So yes, this is a functionally driven question and is extremely specific, as you see there, to the act of sitting up at the side of the bed with feet flat on the floor. The levels of assistance are definitely different than what we've been seeing in the current 1800 series of just kind of more broad categories about, assistance being anything another human has to do. This is breaking this down. So in that first column, we need to capture their current ability to safely do this and what kind of assistance they need. You can see that on that assessment portion, there's also 3 options at the bottom if we're unable to do it. So it's either medically unsafe to do it or the patient's refusing. We've been given 3 options. But the very different thing is the second column, where we're expected to project a goal for this. This is going to be a very interesting discussion over the next year about a goal-setting piece within OASIS and the fact that in home health, overwhelmingly, the admissions are being done by nursing because of the regulatory issue. And how well has nursing and therapy been collaborating to date? Because this could have a bearing on the comfort level and competence of the individual making that projection, and are we going to be agreeable as a team as to what that would look like? So this one is definitely going to require more discussion over the next year. Then we see some things that were modified and renumbered, particularly around some of the integument questions. And clearly what we're already seeing is this in particular is moving in that direction around standardization across the post-acute settings. What's interesting is we still see this item in basically taking an inventory as we do a skin assessment of how many of these things are present. And yes, this is just a portion of the item the entire item still exists. But what's interesting to note is they've gotten away from the Roman numeral thing and have changed throughout the integument section to actually the numbers 1, 2, 3, and 4. As well as you can see here, trying to still clean up, as it were, the items themselves to help clinicians better understand what they're being asked to capture. Because here, it's the number that are on them currently. Then we see some modification and renumbering happening in relation to the worsening issue. And just by first glance at the table, it does look cleaner than the one we have in OASIS C1 right now. But we're going to need to, again, make sure the clinicians are very proficient in how they answer this question and understand what worsening truly means. As Dee and I travel throughout the country and talk with clinicians, I still think there's a struggle here about worsening in the clinical sense, or in my opinion, an assessment skill set, versus how OASIS is choosing to define the parameters of that. So definitely something that needs to be part of an educational plan going forward. We also see, in relation to these medication questions, that there's been some renumbering and modifications. What's interesting is that I looked at it the first time and thought, it doesn't look different. What's wrong with it? Well, what they did is they got rid of the word problem. The problem issue, I think, has always been kind of a, well, this really has changed it to identifying clinically significant issues. Again, may seem like a semantic issue, but I do think it's a better word choice. Also, we can see in a couple of these that it has further clarified the 1 calendar day issue in relation to our ability to say, yes, that we have had two-way communication with the physician about an identified issue, to be very specific about what that 1 calendar day actually looks like. Our final piece is this look back period, and so you'll see the items that have been affected. What's currently M1500, 1510, 2015, 2300, and 2400, all of those items have a similar phrase in them, referring to the look back period as at the time of or at any time since the previous OASIS assessment. What we see in OASIS C2 is that the numbering of the item itself has all been bumped up by 1. So you can see it's now 1501, 1511, and so forth. But the phraseology has been tweaked slightly. At the time of or at any time since the most recent start of care or resumption of care assessment. I think it's an attempt, again, to be very specific, things that have come up in the Q&As that have been modified or tweaked or tried to be educated on with respect to the manual. I think it's a good thing when the wording of the questions does catch up to more specific instruction, so that people really are thinking about exactly what you're looking at here. So these are the issues at hand. These are the changes that we see right now. Again, not anything that I would say is earth-shattering. They haven't like blown it up and started over. But we also know our tendency to wait and see. And what we believe at Kornetti and Krafft is we got to get ahead of this. We got to start thinking about those issues that are giving us frustration already with OASIS. How do we work toward managing those so that we're managing for quality and not always OASIS police people trying to make sure that the answers are correct, but to really look at this as another positive opportunity to enhance our data collection. So there will be more to come. We just wanted to kind of test the waters, give you that kind of overview piece of those changes. Trust me, more needs to be digested and thought through, and we will be providing that information to you as your partners in preparing for this change in OASIS. Thank you very much and have a great rest of your day.